You're listening to the podcast between doctors and friends. Welcome to another episode of Between Doctors and Friends podcast. We have in today's episode our usual suspects, Dr. Ray Anobigine and Dr. Foz, a primary care physician, and we have some guest speakers in the house. How are you doing? Let's start with Dr. Ray and then we go with Dr. Foz.
Doing well. Yeah, it's a nice day today, beautiful weather, doing well.
Nice. And Dr. Foz?
Doing okay. How's everybody?
You know, it's getting warm where I am, and I've been doing a lot of airport pickup and drop off, and I'm wondering, is there another outbreak in COVID, or it's just the usual?
Where I'm at, it's been a little bit COVID quiet, but to be honest with you, I think people are not as concerned about COVID anymore, and people are not testing.
Right. Yeah, I think people are just getting sick, and like it was before, they're sick, they, stay home for a little bit, and then that's it. I think people are not adequately testing for flu or COVID.
Got it. And for the listeners out there, Dr. Ray is currently learning how to belly dance. So when you hear that bell, that's Dr.
Awesome.
Dr. Ray's dog. Well, I want to start this podcast with anything exciting that happened to you guys this week. Dr. Ray?
I'm going to be boring and say no out the door.
Yeah.
That's Dr. Foz.
I think it was a pretty normal week for me. I mean, I did have a friend whose mother had surgery, so I stopped by to check on her, and then we ended up having a lunch, which was very nice. And I had some out-of-town guests who came in because they were in town for a funeral and spent a few nights with me, so that was nice. And then I did a paint and sip event that one of the doctors at the hospital put on. And so that was kind of fun to sit there and paint the picture and have a little social time with some of the physicians at the hospital. So, overall I had a nice week. Nothing
Well,
bad.
we haven't, we skipped last week's podcast. So 2 weeks. How was it for you guys? I don't know if the city you're in, with the weather, your patients, any delays? Complaints, schedule changes because I can't come because it's raining or snowing.
No, I didn't have any of that issues. I think for the most part, people will make the effort to come into their physician's appointments regardless of the weather.
Wow.
Yeah, and for primary care, there's usually such a high need. If there's like last minute cancellations or stuff, we can usually find people who need that slot. So it's not so common for us to have large gaps without somebody who needs care.
Wow. Well, Dr. Ray, you mentioned you had a friend whose mom had surgery. So is this normal for you guys when, doctors with friends, right? Your friends,
Yeah.
Your friends' parents, your friends' relatives.
Yeah, I mean, I will get asked a lot, that my family member, somebody's having a procedure done or something done, and they'll ask me questions about it, and definitely ask me questions if something is normal or not normal.
Your dog wants to comment.
I get asked questions all the time by people in my quote inner circle, and I'm totally fine with that. I want to help where I can. It just gets difficult when I'm asked questions where I don't really know the whole story,
Yeah.
and then I don't want to kind of give half-cooked advice or guidance and stuff. But I mean, I get asked a lot to sign things from people that I know. Like, I need this signed for this. Can you just sign it? Well, I mean, I understand that it's easier for you to just hand it to me to do because you know me and all that stuff. But, I'm putting my, my professional, accomplishments here on the line whenever I do that, because I can't just sign stuff for convenience. I mean, a lot of these people are not necessarily my patient even. They're friends of mine. And it's like, it's so much easier to talk to me than to have to try to get a hold of their doctor, who might say, oh, you need an appointment or something. But it does sometimes put me in a little bit of an ethical position. Like, I want to help, and it depends on what it is, but I can't stretch the truth too far, if that makes any sense.
Yeah. Yeah. So, I mean, for those who have doctor friends in their lives, you bring up a good scenario there that, it's hard to just do a blanket diagnosis. I mean, even in this podcast, right? That we expect you to know the answers to, the pain that we're experiencing on our shoulder.
Well, we can help to some degree, I mean, I feel pretty strongly that in a lot of circumstances, the patient will tell you what they have if you have a chance to listen. Like, if you can listen, and if they can try to describe what they've been experiencing, it can tell you kind of where you're going with it. But there are times when the physical exam is important, and diagnostic studies are important, and interpretation of those things shouldn't be done really necessarily in a vacuum, if that makes any sense.
Got it.
There are some things that are like, clearly, okay, that's a problem. I don't need anything else to tell me that this is the issue. But there are some times when things are more subtle, or requesting like what's your opinion on this? And it's like, well, there's sometimes a little tiny nugget of information that changes everything.
Well, we heard Dr. Ray's dog, and this is a silly question for both of you, because you're doctors. Do people kind of like, hey, Dr. Ray, like, my dog or my cat is pregnant. Can you help me this and that? And then Dr. Foz.
No,
my dog
never.
Never? I know
do
Dr.
get asked
Foz
pet
has gotten
questions.
that.
I do get asked pet questions, but I don't, and that's what's hard, because I mean, I have pets too, and I know enough to be dangerous and not enough to be entirely helpful when it comes to veterinary medicine.
All right. We're gonna break
if
it
any
down
veterinarian would like to be my BFF, come join us. I'll swap medical advice for veterinary advice.
We've got to bring in some vets here. All right, we're gonna break it down. Dr. Ray, I'll start with you. How big of a difference is it when dogs are pregnant versus the human?
I have no
my
idea.
God, are you serious?
I have no idea.
No idea. You guys
I
did
have no idea.
All right. What about Dr. Foz? Like, like basic,
Well, I mean, mammals get pregnant just like humans. Humans are mammals, but that's about it. Dogs usually have litters. Humans don't. There's a lot different.
Like, my dog got a cut. If I call one of you guys, can you guys help me with this?
Well, I can probably tell you how serious it is. I mean, cuts are cuts on mammals, right? But infections are infections on mammals, right? But what causes them,
not to put you guys on the spot.
how you manage them, all those things are quite different.
I think we had someone got hurt in my household, and we had someone call the neighbor, and the neighbor turned out to be a vet. I'm sure vets get the same.
Probably.
Like, I'm a vet.
Well, it's interesting. One of my pets actually was recently ill, and the veterinarian that I had worked with for many, many years has retired, and that guy was an amazing, amazing veterinarian. I hope he's well and still alive and just retired, and I have nothing but the most wonderful things to say about him as a human being. Just knew a lot, had a lot of experience, was very sensible, like just an all around wonderful person who was just trying to help, And so I had to, and this is kind of urgent, I had to find somebody on the fly. So what did I do? I do what you're not supposed to do when it comes to human medicine. Is I went to, a review platform, be like, okay, who's close by and who could I use? So I found somebody who was reasonably rated, I guess, and was local. And I had even reached out to like friends of mine who I know are pet people. I'm like, do you know anybody local? And it wasn't like their local was like 30 miles away from me, like through bad traffic local. So it was like, okay, that's going to be difficult. And I can't, like, I don't know. So I went with this person and it was not a good experience.
Oh.
Yeah, there's a lot of, how would I describe it? I go in there, here's the problem. The pet is showing the problem, like, look right here. And it's kind of obvious what the problem probably is. And there was a lot of like, okay, this is what I'm going to check him out. And then the doctor walks out of the room and then sends in the technician. And the technician was I felt like I was buying a car. I really felt like I was buying a car. Like, okay, this is what we're going to do. This is the price. These are your options. And it was just like, okay. And then I started to ask questions like, well, yes, this test should probably be done, but I don't really know if we need to because it's pretty obvious. And they were just kind of not very, I just felt like I was being upsold on things.
Oh, wow.
Like it was like sales. And I was like, look, I want to do what's right and I do want to do what's best, but I don't want to do things just to pad your bill for reasons that like, can you give me 3 seconds to just help me understand a little bit better? Because unfortunately I know enough to be a pain in your tushy. And it was really difficult. It was a really difficult interaction. And, like I didn't really have any choice because the pet was going to get much worse. And so I just kind of did what I could. And fortunately, my pet is fine now, but I was not happy because there was a real lack of communication and just everything was really, I don't want to say rushed. That wasn't really what it was. It was sort of high pressure in that, yes, please authorize this $600 test right now, and there was like, okay, we're going to shoot some x-rays. I'm like, okay, what are we x-raying? And then it was like, well, we can do one film in the house and the doctor will interpret it. And it may not be the best interpretation because they're not a radiologist. Or we can do 3 and then we send it out and then the radiologists tell us really, and that's a really better choice. And I'm like, wait, what? Like, I don't like, yeah, I'm like, wait a minute. What do you mean by that? It was just, so I'm going to get substandard. I don't know. It was just weird. And if she's not qualified to read radiology films, then maybe she shouldn't be reading them. How come you don't send out a single film? I'll pay for that. A lot of places who don't have, just so you know, don't necessarily have like imaging interpretation on site, right? So some places do, where if you ordered x-ray, the patient goes downstairs or upstairs or the building next door, and then there's a film that's generated and a report that's given to you pretty much immediately, or at least you can read the film yourself and while you wait for an official report from the reading radiologist, who is a medical doctor who's trained just to read imaging. But there are in other places, like I used to work at a place where we had imaging, but we didn't have an on-site radiologist. And so there was like a contracted radiologist who would receive the images electronically and then generate a report, usually within a few hours. So I could shoot the picture, but and if there was anything obvious, I could tell you what the problem was. But I am not a radiologist and, I would have to wait for a formal report. So I think that's kind of what they were getting at. But apparently the contract is they have to send at least 3 shots before I don't know. It was really weird. It was almost like it wasn't an option to have an actual radiologist read the picture as opposed to the primary veterinarian. And I just sort of felt Like I was getting upsold on options on a car. That's exactly how I felt.
Well, in the past episodes, we've talked about, doctors as patients and how you two doctors feel about patients and nurses. This is an interesting, doctors as vet patients.
I know, right?
You're
Of
both,
weird situations.
Very interesting indeed. Like, I love these conversations.
Remember, doctors and friends, these are the stuff that we talk about. But it was like, I don't know. I wasn't happy with what happened. And I felt
back up for a second.
Yeah. See.
So I'm going to assume you don't tell your vet, your physician.
I try to go in there and let them do their job.
Okay.
I try not to go in there swinging. Like, I don't go in there like, hey, I'm a doctor, you better treat me differently. Okay. That's totally garbage. Like, I'm not an expert in this person's field. Like, it's just like, I would not want a veterinarian come in and swing in and tell me how to manage, like, somebody's hypertension or something. Like, I think that would be weird, right? But, I always, if I have somebody who's in the health sciences in some capacity, I will always acknowledge that. And why? Because I see it as like, we're on the same side of the battle.
Yeah.
Okay. I don't care if you're a nurse assistant. I don't care if you're the custodial assistant in a hospital. You're one of ours. You also help this machine function that takes care of patients and people and all those things. And so, of course, I'll be, I can't say I'm going to give you better care. I'm going to give everybody the best I can, but I might make it a little bit more. I want you to feel that you're part of the team, if that makes any sense, and my previous veterinarian was like, and I would always tell him, I'm like, look, I'm dangerous. Okay. Like I'm enough to be a pain in your tushy, but he was always willing to talk about stuff. And I don't mean like, hey, let me spend a half an hour discussing the ins and outs of this, cellular mechanism. That's not what I want.
Yeah.
I just want to know why you're recommending something that seems like not really logical in a medical sense. And I fully acknowledge that things are different. Like even in like adult medicine and pediatrics, very, very different. Like the management, like a really great example of this, just as a broad example, is in critical care for like the elderly versus like a pediatric patient. If you have like a child who is in respiratory failure because they are, they have a severe pneumonia and they're not able to breathe enough on their own, and we have to put them on a breathing machine, on life support, on a ventilator to help them breathe. With peds in a healthy child or a kid who is otherwise, pretty healthy, it doesn't have to be 100% healthy. A lot of times we'll leave the child on, and please forgive me, it's been a long time since I've done these things. Like we'll leave the child on the ventilator for an extra day or two just for them to rest. Like they need to rest. We'll do the breathing for them and then let them recover. And then we'll gradually, taper down things and extubate the child, and then they'll be better. In adults and the elderly, you don't want to do that. Like a rule of thumb, and these are very broad, every situation is different. Like you want to get, especially the elderly, get them off the vent as soon as you can, get them breathing on their own, because this is just a nidus for infection, and they get weaker and weaker as we go. Pretty soon they're too weak, they can't even breathe on their own. Like it's kind of like a general fit. So even in human medicine, there's this huge
I'm going to ask you a question about that later.
But yeah, the veterinary thing, and then you take it out in like way left field, right? But, infections are infections, but let's just talk about like, I don't know, pneumonia. Like the organisms that cause pneumonia in, a typical companion animal is going to probably be wildly different than in a human. And so there's all of those issues that are different. The metabolism is different. Certain medications are toxic versus not. And so even though a lot of veterinary medicine is gleaned from human medicine, and I'm sure the other way, but I don't know. I didn't have a great experience. I'm still in the market for a good veterinarian, which is a little terrifying because my pet is not getting any younger. And, I don't know. I didn't have a great experience because mostly because I felt like I was being sold something. And if it's necessary, of course, like that's why I'm here. But you're making me feel like you're just trying to pad the bill. Like like I feel like that's what it was. And the way
do you guys question this? Compared to
I did.
your practice.
Well, I mean, the funny thing is the office was very nice. The doctor was very nice. Talked a mile a minute, like very, very fast. Hardly looked at the pet, but also the problem was fairly, here you go.
Obvious.
And then when I asked questions about like, okay, usually if somebody comes in and they say, I have a cough and I get a little bit of a history, this is just a brief example. And I'll be like, okay, most likely it's this. Like the top 3 causes are usually this. And this is what we're going to do to figure out why, or this is how we're going to treat you. I kind of give you a little like what to expect and why. I do think that's important because we need to understand each other. We need to be on the same team, right? We're not fighting each other. We're fighting the problem. And I need you to understand why when I tell you to go take this medicine for this long or do this or something, like there's a reason for it as opposed to just blindly telling people, just go do this, right? I don't think that patriarchal kind of I'm telling you what to do goes over very well in any circumstance, but that's I wasn't even getting that. I was just getting a bunch of like, there was I felt like she was almost talking just to talk. But there wasn't any information.
Wow.
And then I was like, oh, okay. And then she's like, okay, well, I'm like, well, what are we looking at? Like, am I going to have to cough up a couple grand for this or what's the deal? And then she's like, okay. And she just like walked out. And then a few minutes later, her technician walks in, and a veterinary technician is, my understanding is they're kind of like the equivalent of a nurse. They're like a pet nurse, right? They see a lot. They do a lot. They do a lot of the procedures and assist with the procedures. And, and then this person didn't even like introduce himself. He just started, okay. So, and then he opens up the chart. I thought it was really cute because like my pet has like a little chart in their electronic health record system.
Yeah.
Like that's adorable. And then especially if you have a pet with like a ridiculous name, right? It's like,
yep.
I don't know. And so they just started like, okay, so here's this and here's this. And I'm like, okay, so I'm like, sir, who are you? Like, who am I talking to? Like,
wow. You guys go through
they should have introduced them. It's like, hey, I'm so-and-so, blah, blah, blah. I come in here to help with some of these details while the doctor's busy with somebody else now. And, it was just,
wow.
Communication was poor. Just everything was not good.
Wow. Dr. Ray, what about you? Your experience with a vet?
Well, my vet is a family friend, so he knew I was a doctor. I knew him since I was in high school. So
okay.
That's so awesome.
Yeah, very conveniently, I ended up living near his practice. And when we got the dog, I was like, well, I'll just take it to him because he's the only vet I know. So it wasn't any big deal. And, when I showed up, he knew exactly who I was. And so I didn't have to say anything or do anything. And I didn't doubt anything he ever told me or question it because,
Does it amuse you though when you go visit a vet, like how their practice runs?
Not really, because I'm scared about my pet.
I mean, not really. I mean, it's very similar. I mean, you check in just like we check in, and you sit and you wait until your name's called, and then they weigh the dog and they bring him into the room, and you sit and wait till the doctor comes and he asks you what's wrong. And so it's very similar to, how my office is run pretty much. But that doctor is getting a little older, and so he's hired some other younger vets to come in. And so I've associated with those other vets. But to be honest, I'm so busy in my life that 90% of the time when I go to the vet, I rush home to pick the dog up and take him to the vet, and I'm usually in scrubs. And so sometimes someone will ask me a question like, oh, are you in the medical field or something? And then it just sort of comes up. I think in the, 9 years that I've had the dog, I think he's had 3 younger vets who kind of come through. And then I think the way it works with them is they kind of come through, they gain a couple years experience, and then maybe they go off and open up their own practice. So for two of them, it was just a very general interaction with them, nothing too out of the ordinary. They asked if I was a doctor, what kind, and then that sort of ended the conversation. But he has a newer doctor with him now that I've seen maybe 3 or 4 times when I bring the dog in, and she's quite a character. She's very young and spunky and just has way too much energy for me. And she's very excited about the dogs and her life and everything.
Oh, that's
and
nice.
so she, was just, when I told her, what I did, then she got so excited and was asking so many questions about my life and everything, and was just, it was just sort of like, look, I'm just here to get his shots. I need to go. I'm tired, but she had so much energy. She just talks very animated, and she's just
Well, we
so
should invite her to
excited.
this podcast.
We should. She's very much the opposite of what I am, where I'm just like, look, I'm just getting through the day barely, and that's all I want to do. But, she's very nice, and she's very kind to the dogs and everything. And then at one of the visits, she mentioned that, she had she had moved to the area for the job after finishing up her school, and she didn't have a gynecologist, and she was overdue. Would it be weird if she came to me? And I was like, no. And so she did end up coming to me. And so, she was very excited in the office too. She was like, oh, your office is so pretty. So this, and just like way
Did
too
she
much
talk
energy.
your ear off too?
No,
Wow.
she does like to talk quite a bit, but it was reasonable. It wasn't like an overly long conversation. I think because we've had other conversations before, but I think if it was maybe her very first time in the office, I think it may have gotten a little bit out of control.
You guys have like a barter system going on?
I like that though. I think that's super cool because there's a trust that's established, and not all personalities are going to be 100% meshed, but I'd rather have somebody who's like talkative, enthusiastic than like sullen and angry.
Right. And so, and then I've taken the dog subsequently to go see her. And so now she walks in like we're friends. She's just like, hey, how's it going? And, so it's very nice, I think that,
trust.
For me,
we have developed trust.
Exactly.
That's awesome.
Yeah. And so for me, it's nice to have had this family friend vet office because I don't ever feel like I'm getting taken advantage of, even though I'm a doctor, I don't know veterinary medicine. If they came to me and they said, oh, your dog has XYZ and it needs this treatment, I'd probably be like, okay, I guess it needs that treatment. And so I know from, many, many horror stories of people with their animals that the prices can get really out of control for all sorts of dog surgeries and dog emergencies and dog and cat, animal emergencies and treatments and everything. And, animal lovers, it's very hard to say no, if they say, your dog is sick and it needs a $5,000 treatment, many people would not hesitate to be like, okay, do whatever you can do because I love this dog, So it's been very good for me to have them because whatever he says needs to be done, I know he's not trying to do anything unusual. Plus, I don't think he's the type of person. He's a very good, honest man who I feel like has done enough in his life. He doesn't need to nickel and dime his customers. So I feel like he's a very honest, good vet that even if I didn't know him as a family member, I don't think that he's the type of person to do that. So yeah.
This is a fascinating topic that we kind of like went into, right? Doctors and
unintended.
Unintended. We started this podcast. I think our first episode, we talked about supplements. I saw a vet that just loved to give supplements. And, my little story about that was, I took the dogs there and I was warned, don't make her give you supplements. But then I'm just like, going out, this vet's like, okay, on your way out, these dogs need to take these supplements, like $400, $500 worth of supplements. And I'm like, oh, okay, sure. And they came back like Jack and the Beanstalk. Like, why did you take the supplements? And I said,
Well, see,
hey,
that's what happens a lot in doctor's offices, though, right? Like you like it's like you don't ask the questions. You just, yes, ma'am, no, ma'am,
yeah,
yes or no, sir.
right. I said, I just felt like I went in there, they spun me around, and then they told me to walk. I'm just like grabbing whatever I could grab. I'm like, I don't know. And when I told the vet, one of the dogs, the owners, I was just taking, on their behalf. I said, yeah, the owner's sick. So, but I didn't think she heard me say that the owner's sick. She heard me say the owner's name. And she's like, oh, that owner's name. She also needs to take these supplements. I'm just like, by the way, one of these $400
Well,
supplements is also for you.
that's where I get a little suspicious with things, because I have worked in several different roles in my
Hmm.
medical career, and one of them was as a consultant, and it's. Mm, and so my role was I had to evaluate other healthcare providers, not for disciplinary reasons, but for health reasons, right?
Uh huh.
And there's a lot of, this was many years ago. There's a lot of places, a lot of people will sell stuff in their offices if they're in private practice that, they, they want you to buy something because it's for profit. Now, they might also feel strongly about certain products, and that's okay. I just don't know about selling it. It's one thing for me to make a recommendation. It's another one for me to sell it. Oh, you can just buy a bottle from the receptionist up front. Like that's
Yeah.
sort of, yeah.
So
Because not only do you make money on the sale, and that that becomes not objective any longer.
Yeah. Yeah. And you know what? This vet turned out to be like some very famous person's daughter. And when Nextdoor, launched, we had I had complained about this local vet. That vet heard about it. Wrote a check here. Wrote a check back. So speaking of dog supplements, can humans take
Are you serious?
dog supplements?
I have no idea.
No.
No,
you should not take things that are not designed for humans. No.
Yeah. I mean, I don't, maybe, a lot of it. I mean, I know I give my dog a lot of human medications.
Really?
But I don't know if the reverse.
Under the guidance of her veterinarian, because not all animals can take all human medications. Let's make this abundantly clear. Okay. That would be under the guidance of her veterinarian.
Yeah. Like he has a lot of allergies, and so, I mean, again, like I said, my vet is very honest. So I think at some point he was like, I can prescribe him, whatever the allergy medication was, and then they have it, I guess the vet offices maybe sell it there. And so, yeah, they're maybe selling it for a certain price. But then he told me, he goes, you can just prescribe it to, yourself and give it to him. It's the same medication, the same human medication. And so I was like, okay. And then I got it super cheap, much like maybe a fifth of the price of what he was trying to sell it to me for.
And I've done that with antibiotics too. It's like, and I don't use my insurance so that I pay for it out of pocket, as a cash pay, but a lot of things are generic and inexpensive and you can, but see, that's under veterinary guidance.
Yeah. And then he has a little heart murmur. So he's like, give him fish oil and give him tyrosine, I think, or something else. And he's like, yeah, just buy them on Amazon, so it's the human version. So every now and then I'll give him a fish oil and then I'll be like, maybe I should take one, and then I'll take one too. But I don't go the other way around. I don't, if he gave him something, I mean, but I would read the bottle, because if the bottle said, like it's amoxicillin and that's, just the general amoxicillin, and I thought maybe I needed a tablet, I would take it. But in general, I think.
Like for example, gabapentin.
No. I mean, be careful with that.
Yeah.
The liquid you have to be careful with, because in smaller pets, they may need much lower doses and it's hard to cut a capsule. So there's a liquid that's available but I believe the liquid often has xylitol in it, which is toxic to pets. So
Wow, there you go.
and it's not for humans. So just because it's safe for humans doesn't mean it's safe for pets. Please don't forget that.
Wow. Yeah, because that's good to hear,
And then there's stuff that you can get like for like farm animals and stuff, and that is not, it's not really human grade theoretically, though I would hope that it is. I mean, there's a difference, so I would be very careful you should not do that. You should always seek direction from your physician or a veterinarian.
Wow. So you can't raid your dog's medical stuff. Like, what is it that? Oh God, I always have this. My dogs always get like ear infection.
What?
My dogs always get ear infection, and I just get this thing from Amazon, like these drops. All right.
Well, I'm sure there's a lot of things. I mean, once again, they are mammals, so there's a lot of things that are going to work, but there's enough things that make it different that you have to be careful.
So, like, your dog gets a cut, don't give them Eucerin, right? Isn't like Eucerin like bad for dogs? No, not Eucerin. What is that? I'm gonna have to trim this part.
Yes, please.
What's that ointment you put on your cut, humans?
Oh, Neosporin?
Like
Neosporin. That's it.
I don't know if
dogs bad for dogs.
I don't know. I have no idea.
You guys are doctors. You guys are not vets. There you go.
Well, okay, if it makes you feel better, I don't usually recommend Neosporin. Okay, let me back this up. Triple antibiotic ointment for humans either, because the third component of that the neomycin component actually does cause a contact dermatitis in people, and I have seen that happen before. So double antibiotic ointment I prefer for people to use if they're going to use a product like that over the triple, because you could have a contact dermatitis from it.
Wait, back it up. Did you hear that, Auntie?
I heard it. I have a follow-up question. So, like, how do you feel about the like the bandages that have that formula in them? Like, you wouldn't recommend those either?
Well, there's several topical antibiotic type things that are over the counter that are not the same issue, but I have seen it, and people go, "Oh, that never happens." I'm like, "Yes, it does," and it's really bad when you have it like on your face or something. But yeah, there's one component of the triple antibiotic ointment jellies that you can get like in any pharmacy or grocery store over the counter is neomycin, and that some people can be sensitive to it, and it causes essentially a contact dermatitis. So I don't really recommend that, and I don't really think that topical antibiotics like that make that much of a difference in a lot of cases, to be honest with you. Like, I think the role is fairly limited.
Thank you, Dr. Foz, because as someone who suffers from eczema and has for a very long time, and now even to this day, I'm trying to manage it. But there are a lot of people don't realize just the type of dermatitis or any other type of skin conditions that you can easily get from just random things. So, like, this is actually really refreshing to hear.
Yeah, well, I mean, eczema and dermatitis are very broad topics, and there's a lot of different subtypes. The one I'm referring to it's technically what we would call a contact dermatitis. So it's kind of like, it's not an allergy per se, it's just an intolerance or an irritant. It's like poison ivy. Like, if people touch poison ivy or poison oak and you get a rash from it, that's not an allergy, that's a contact dermatitis. It's like a chemical irritant, almost to say. And it's the same thing with that. And then I think a lot of times when people get rashes from eczema, they think it may be infected. Oh, I'll put antibiotics in it. If you put neomycin on it, it might make it a little worse, technically. So coming to a diagnosis is important.
Wow. What about, I had to step away, hydrocortisone, like 1% plus? Dr. Foster told me something about this, and, not to spread it too much.
That's one of my friends, but yeah, you have to use a really thin amount.
All right, Dr. Foss, educate us.
So always seek advice from your personal physicians. But in general, topical corticosteroids, including hydrocortisone, if you put them on long enough concentration, you could do a couple of things. First of all, you could absorb too much into the body, and that can cause problems with your adrenal glands, theoretically. And so it depends a lot on the strength of, the actual agent. So over-the-counter hydrocortisone in the concentrations that are sold are not likely to be, the risk for that is lower. Okay. Because it's not zero, but it's lower. And then if you're giving a really potent topical corticosteroid from your doctor or your dermatologist, they'll often give you cautions on that. And then the other issue is too much, too long can also cause thinning of the skin locally, and the skin can tear and look just like paper, and just tear. And it can also have pigment problems and just be cosmetically bad because it's damaged it. So you want to use it with judiciousness. They have a role. Don't be afraid of them, but use them properly.
Wow. Okay. That's good to hear. I know, some people, they take it when they go to places that have too much sun. Why is that? Is it because of
topical steroids?
Yeah.
I think you're...
Yeah, I think you might be mixing that up with sunscreen, because they tell you that, that's not good to really sit in the sun. If
yeah. Could you take hydrocortisone? Maybe I'm talking about because they get mosquito bites.
Well, yeah. So, theoretically, if you put a topical corticosteroid over a sunburn, it'll decrease the inflammation. We don't recommend that. Don't do that. And it can be helpful on a little spot if you have a minor bug bite or something. But that's really the only role of the sun.
Yeah, just get Vicks.
What? You and your Vicks?
Yeah. Because it's got menthol that, the insects don't like. But I'm not a doctor.
You just play one online.
I just play one online. Okay, so, hydrocortisone, I know what they sell in the store is 1%. So 2% are prescription.
There's a 0.5%. There's a 0.5%
really?
Too that's over the counter. Yeah.
Okay. All right. I want to switch topics here. Yesterday I was on social media and I saw this post. I'm going to read it. Short post. My mom went to the hospital for 1 hour of Bell's palsy, for which she had to wait for 9 hours in the emergency room. The bill came today. It was $10,000. They gave her a steroid, which did nothing, and a bunch of blood tests completed in the same hour. She recovered through acupuncture therapy and eating garlic in the early morning. Ayurveda. You need to be in a certain tax bracket to afford hospital visits. Blah 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 blah. What? These are things that people are posting. You guys heard of that? Such things.
Wait, from where are we? What?
I read this on X.
Oh. Okay, I didn't know if this was somebody that...
No, this is just some person.
Or should know.
No.
Well,
what's your feedback? What's your reaction to this?
I think that, my reactions are healthcare is a human right and a luxury, and it is treated as such in the United States. And number one. Number two is you need better health insurance, which should not even be a conversation that we should have to have. Number three is, unfortunately, Bell's palsy can be difficult to treat. It doesn't always respond to treatment. It is one of those things that sometimes happens, and It is what it is. We do the best we can. A lot of it depends on when the onset is, and when you seek treatment, and et cetera, et cetera. There's a million complicating factors. Number 4 is sequence does not imply a consequence. So if you had Bell's palsy and then you ate garlic and then it went away, perhaps it would have went away regardless of the garlic.
Right.
And that's where misinformation comes about, because I think sometimes people genuinely feel that they're trying to help by putting information out there that would be like, okay, I'm just going to say it like broadly. If garlic cures Bell's palsy, let's just use that statement. You know, I had Bell's palsy and then I ate garlic and then it went away. If it was so simple, like, I can guarantee you that we would tell you to do that as physicians. We want your problems to go away. Nobody is trying to withhold anything from anybody, right? Like, it's not about like, And so that's where misinformation sometimes can start.
Yeah.
And that's okay. And if you want to treat your Bell's palsy with garlic, that is your business. Please be aware of the risks and benefits, and please don't generalize that to everybody because that may not work for everybody. And yeah, everybody has a platform now, right? Even me here, little old me. I can sit here and tell people stuff, right?
Mm-hmm.
So just because you can say it, I mean, I could be a total kook. You never know. Don't take my advice. Your doctors.
You know, you nailed that, because, you know, when I read this, I was like, how silly is this? I mean, you know, of course the price.
Oh, guaranteed. There's going to be at least like 5 people who are going to come in my office now asking me about garlic for their Bell's palsy. But, you know, I think the biggest tragedy is somebody has to pay that bill. And then, you know, Bell's palsy is a clinical diagnosis. So I imagine the emergency room is going to run a few tests just to be sure, but did they call an ambulance? Was that involved? You know, are they not insured at all, or do they have an extremely high deductible? Did you try to negotiate with the hospital if you don't have insurance or you have like limited coverage? Be like, yo, I can't afford this. Can you cut me a deal? Like, you know.
Yeah, I saw in the episode of The Pit that you could actually, you know, talk to the hospital. They'll work with you.
You should always talk to billing. You should always talk to billing. Now, that doesn't mean they're going to do anything. I think that there's enough cold fishes out there, and I think there's enough for profits and just whoever. But I mean, I don't know. That's tragic. I think it's tragic because somebody, and so I where I currently am, I have a lot of patients from Europe and Canada and South America, Asia, all these places, all over the world, I guess I should say. And they're like, yeah, I'm here for now, but when I have real problems, I'm going back home because I can't afford the health insurance here. I can't afford to be sick here. Yeah, I know.
Well, you know, that's interesting that you brought that up, because, you know, a friend of mine, you know, we were discussing this like just a few nights ago, of going abroad for medical care.
Yeah.
Because it's cheaper. What are your thoughts?
Yeah, it happens a lot. I know that a lot of people go to the dentist in south of the border, and a lot of people travel internationally for cosmetic procedures.
Wow. Dr. Ray?
Yeah, I mean, I've heard that too. A lot of people.
Uh-huh. You know, to maybe like looking into retiring abroad because medical care is cheaper. And I'm just like, that's an interesting, you know, point of view, because
it is in a lot of places. I don't think it's always, but it is.
Yeah.
Yeah, we have someone here that says, you know, I heard about a guy in Italy planning to offer international insurance. Have you heard of that? International insurance, healthcare insurance?
There's travel policies, yeah.
Wow.
That's the extent of, I mean, I don't know of any international insurance otherwise. I know that there's travel policies and like travel, like kind of inclusions or exclusions from certain policies.
I mean, I know someone who, so I'm from the Philippines, right? So, their mother broke their God, I'm not even gonna say the word femur. Okay, their femur. And then 2 years later came here, and it turned out, kind of it broke again. But her surgeons here in the U.S. said that it was done very well, except the material is not what they use now. So, and I hear complaints about that from friends and relatives, in other countries where their approach is very good, or their treatment is very good, but they struggle with the materials.
The medical knowledge, the spread. I've always felt like like medical knowledge should be shared freely for professionals, like paywalls for these things or conferences that I have to cough up $2,500 to go to. In some ways, I think it's kind of weird because medical knowledge, the better you train me, the better I can take care of people and the better I can teach the next generation of doctors. And then we can only continue to get better. Like I feel like philosophically that these things should be spread freely. Like, like the knowledge should be spread easily. And now in the age of fast and rapid data transmission, like I imagine that medicine and concepts and standards of care that evolve in places that are cutting edge theoretically can then disseminate to places where you may not have the resources to perform that type of research or have the, that knowledge can spread to places where it may not be as available. And then of course, we in the United States think we're the end all and be all, but that's not really true. Like medical care in a lot of the world is quite excellent. And the trickle down goes the other way, And so, and that's great. Like that's how we all get better at what we do. That's how we all have better care, but resources are different in different parts of the world still.
Yeah. Access, equipment, they say. Actually, the biggest complaint I hear is from doctors is that we don't have the equipment that the U.S. has. It's so different. So, and I think I'm seeing here in the chat about the international insurance. Listen, you could grab the mic, Anna, because I don't really read. Not just kidding. I don't have my glasses on.
I think I've had this conversation before.
I'm not really a great speaker, so that's why I'm a little shy about grabbing the mic. But yeah, I heard this about this guy in Italy wanting to set up an international insurance. And he talked about how the insurance industry in the United States doesn't have international competition, like say, going back to cars, the car anthology or analogy or anyway. So he was proposing that. And you hear about it. You hear about people going to Mexico for dental or even plastic surgery. And some of it's scammy and icky and some of it's quite professional. So yeah, and I know friends in like Switzerland, but they live there, they have insurance. But when I was in Germany, I got excellent medical care. And you think about it, and I have a friend in Berlin who he's American, but he's got German. His dad's German, so he can work and live in Germany as a German. He's got dual citizenship, but he's got a medical condition that he couldn't afford to take care of here. But that's why he's living in Germany. So I like the international insurance.
Yeah, I mean, I think it's anything that gets us the care that we need. It's just unfortunate it has to become so that you may have to cross international boundaries for that. Like, really?
Yeah.
In this time and age? Like, really?
Yeah.
What are your thoughts about Doctors Without Borders? Would you do that?
Was going to.
Really?
Yeah. Long time ago.
You guys can do it when I go to the Philippines. Come with me.
I was gonna do it when I was young and spunky. Of which I am now neither. I think, once again, medical care is a human right. It is not a luxury.
Mm-hmm. But Dr. Ray's gonna have to stay there for like 9 months. Take care of. Dr. Ray, are you still here?
Yeah, I'm here.
We'll do Doctors Without Borders.
Yeah.
My version. Stay there for 9 months.
No, I wouldn't do that. Yeah, I would not do that. Yeah.
We have Auntie. I trained Doctors With Borders how to use Teams. There you go. Actually, Auntie Anna, Dr. Foz, and I have something in common, is that we know a little bit of German. A little bit, except for Anna.
Hey, guten Tag, wie geht's?
Oh my God. Because now I get it mixed up with Spanish and a little bit of Mandarin that I've learned. Oh my God. Okay. It's all, now I have international word salad in my brain. It's really bad.
I know. Well, I'm going to, Anna and I were talking about this. We're like, oh, Mexico City. So for listeners in the U.S. that are interested in perhaps
like there's listeners internationally? Sorry.
Yeah, we have listeners internationally. We're global here.
Oh, wait, there's listeners?
If they were to have a procedure abroad, any basic, just very basic things that they should look for, kind of
do your due diligence.
Uh-huh.
Like I would make sure that you vet wherever you're going and who's doing what, who's calling the shots. The biggest concern I've had, so in one of my many previous roles, one of my associates, a non-medical provider, business associate, wanted to get a medical procedure in a completely different state, like across the country. And it was cosmetic, right? Mm-hmm. And I was like, because the associate kept saying, but this person is the best. This person is the best. I'm like, okay, I don't know how you determine that. Like based on what? Like based on Yelp? Like based on what, right? And so it's cosmetic. It's a fairly common cosmetic procedure. I'm sure there's like 1 million people, locally that could do it. But she was set on having this procedure done in a completely different state across the country. And I'm like, you do you. But what are you going to do if there's a complication? Like you're flying out, you're going to have the procedure, you'll stay there for like a few days and then you're going to come back home. Then how do you handle the post-op? Like how does that work?
Okay.
And then what if you have like a complication that arises not in the immediate post-operative period, right? So then, yeah, and it ended up happening and it was a problem. And then she came to me advice and I'm like, I don't know. You need to talk to your plastic surgeon.
What they all end up doing is they end up going to U.S.-based doctors or the emergency room, and it's a big frustration in the doctor community to see this, that they go to another country, they fly back way too soon, and now they've got complications, and now they expect one of the U.S. doctors to manage these complications. So it's definitely a sore spot in the physician community to have to do this.
Yeah. Especially if they went for something cosmetic and now they come back and now they have a problem and now it's your insurance's responsibility to take care of you because now you have some raging infection or you need to have another surgery or something to repair.
Right.
And so now you've taken that and you have turned something that's cosmetic and you have now made it an insurance responsibility. That's kind of not fair, I think.
Right.
In some ways,
Oh yeah.
Yeah.
But it happens, like the whole post-op complication thing or whatever. I mean, it absolutely does happen more often than people think. And it's not often something terribly dire, but it does happen. And then I can only imagine, like internationally, what would happen in terms of like records. Like they put in an implant or they put in something. Like, do you have, I hope you brought that data back with you. Like, what's it made out of? You know, what were you told to do about it?
So you're saying that if you're going to seek a medical procedure, you know, in other places due to price, due to costs, really consider any like post op. What will happen if things didn't go the way you think it will go, right?
Yeah, complications. Like,
Okay.
and not stuff that come up like right away, you know what I mean? But stuff that happens, you know, you've been there, you had whatever procedure, you're hanging out in a hotel room, you know, with your private nurse that you were given as part of your, you know, package that you bought, but it's, now you're going home, it's been a week, and now it's 3 weeks later and something else has happened. Now what do you do? So you have to seek care locally.
Okay. Well, now I'm posting something
Oh,
in the
my.
Jumbotron. Do you recognize who this is?
Yes.
You do. I actually didn't recognize this.
Yes.
Dr. Foz was not ready. She said, "Oh my." And that I think a lot of people shared that same sentiment when she walked out. They didn't recognize who she was.
Who is this?
Kelly Osbourne.
Oh, yeah. No, yes. Blonde.
I mean, this is not a diet, right? I mean, not that we know, you know, we're just speculating. But
You know, there's trauma and loss in their lives. I know nothing else except that.
Yeah.
And it's not my position to comment on how somebody looks, but there's been terrible things in their lives. Whatever you feel about them, there's terrible things that have happened.
yeah, this is beyond, you know, this is not on purpose. I don't think, but you know.
Well, trauma brings out things too.
Yeah. So, I mean, this is kind of like, okay, this slide right here that, you know, our listeners globally will not see. But, yeah. I mean, I think when I see this, I feel that this is beyond, like, it's not on purpose. Something is happening, but you know, that's what people are talking about.
Oh, wow. Okay.
Well, I think that concludes this episode of Between Doctors and Friends. Any closing remarks, Dr. Ray, Dr. Foz?
No, I think we were all over the place today. Don't really.
Yeah, don't use your dog's medicines and don't give your medicines to your dog.
Okay, so I take away, don't use your dog's medicine.
Non-human species.
Yeah.
Let me ask you, do vets, like, at what point, are you guys taking the same courses as the vet, and at what point do you kind of like, hey, I'm taking care of, like, I'm going to be a doctor for humans, I'm going to be a doctor for animals?
No, the schooling starts out, I mean, the entry requirements might be similar, but the schooling requirements are probably similar, but not the same in a lot of ways. You know what's funny is, like, so when we were in school, like, we had to learn certain things on what they call standardized patients, right? So they would pay somebody, like an actor, to come in and play a role, and we would like do like a lung exam on them or something, and then we would be rated on that. Like, you know, our supervisors would watch us and make sure that we, you know, listen to the right places and ask the right questions or whatever, right? Or it'll be like role acting.
Okay.
They have that. So one of my previous college friends was a veterinary student, and we don't keep in touch any longer, just, you know, like the tides of life. I had flown out when I was interviewing for medical school, so she was a little bit ahead of me and had already started veterinary school when I was starting my med school, like, application process. And I had flown all over the country, like doing interviews, right? And
Wait.
Yeah.
Your mic is popping.
Uh-oh.
Okay.
Is
Go
that
on.
any better?
Yeah, that's better.
Testing. Okay. So, so I had been flying back and forth all over the country, like doing these interviews, and I ended up doing a layover to stay with her. You know, I hadn't seen her in a while, and I stayed with her, and she kind of took me on a tour of the school and all that stuff. It was really cool. It was a really interesting thing, but she took me to see standardized patients that were like the animals. There was like a cow and like goats and like all kinds of stuff. Like it was really wild. So they have standardized patients that they see, and they're just animals. So veterinary medicine remember, it's not just companion animals. It's also like livestock and exotics and all that stuff.
Yeah, there's a show on Animal Planet that I love to like play in the background when I'm working, and he deals with like emergency anything vet I think in Hawaii, and such an interesting,
cool.
Okay.
Yeah, the old vet that I used to really love was just the coolest person. I remember my sibling had to bring in not a cat, not a dog. And we were like, well, who's going to see this one? And we called over there, and they're like, yeah, as long as you can get it here, we'll see it. And if you can't get it here, we'll go up there to see it. Like, so it was just like take all comers, which I thought was awesome. So I'm pretty sure at some point, probably people were like, you need to come out here and see my sheep or llama or something.
So there's no like doctor vet mixer conference?
No.
My goodness, that's an interesting.
But taking applications to have a veterinary medicine friend.
There you go. You heard that.
I will barter. It's about trust. I will barter medical advice trust for veterinary medicine trust. That's it. It's trust. Because you get a relationship, right? But somebody's not trying to sell you a car.
Yeah. Like I'm always buying an iPad. Probably now it's like I'm always buying a cell phone every time I take my pet in. So, all right.